Here's something most people don't realize. After the age of 50, you lose approximately 1 to 2% of your muscle mass every single year if you do nothing to stop it. That might not sound like much, but over a decade, that's 10 to 20% of your strength gone. This process is called sarcopenia, and it's one of the biggest reasons why older adults lose mobility, experience more falls, and struggle with everyday activities. The good news is that sarcopenia is not inevitable. It's largely preventable and even reversible with the right approach. You don't need expensive equipment, you don't need a gym membership, and you definitely don't need to spend hours working out. What you need is consistency, the right exercises, and an understanding of how your body works at this stage of life. Now, before we get into what you should do, let's talk about what you shouldn't do, because I see these mistakes all the time in my practice. First, don't fall into the trap of thinking that staying mobile just means walking more. Walking is fantastic, and I encourage it, but it's not enough on its own. Walking doesn't build the kind of strength you need to get up from a chair, climb stairs, or recover your balance when you trip. Second, don't avoid strength training because you think it's too dangerous or that it's only for young people. The truth is, strength training done correctly is one of the safest and most effective things you can do for your body after 55. Third, don't ignore flexibility and balance work. Strength without mobility is like having a powerful car with rusty steering. You need all three components: strength, flexibility, and balance. Let me also address a common myth. Many people believe that as you age, you should take it easy and avoid challenging your body. This is completely backward. The research is crystal clear. The more you challenge your muscles, bones, and balance systems in a safe and progressive way, the stronger and more resilient they become. Your body adapts to the demands you place on it, regardless of age. I've seen 70-year-olds regain strength they thought was gone forever, simply by starting a consistent routine. So let's talk about what that routine looks like. The foundation of staying mobile and strong after 55 comes down to doing 5 key things every single day. These aren't random exercises. They're based on decades of research and clinical practice, and they target the exact systems that decline with age. I'm going to walk you through each one, explain why it matters, and show you how to do it safely, even if you have arthritis, high blood pressure, diabetes, or other common conditions. And I'll tell you exactly when to stop and seek medical attention, because safety always comes first. The first thing you need to do every day is some form of lower body strengthening. Your legs are your foundation. They're what keep you upright, what get you out of a chair, what carry you upstairs, and what catch you when you stumble. The single most important exercise for this is the sit-to-stand movement, also called a chair squat. Here's how you do it. Find a sturdy chair with armrests if you need them. Sit down with your feet flat on the floor, hip-width apart. Lean forward slightly from your hips, not your back. Then, without using your hands if possible, push through your heels and stand up. Lower yourself back down with control. That's 1 repetition. Start with 5 to 10 repetitions, and do this 2 to 3 times throughout the day. If you can't stand up without using your hands, that's fine. Use your hands on the armrest to help you, but try to do a little more of the work with your legs each week. This exercise strengthens your quadriceps, glutes, and core, which are critical for mobility. If you have knee pain, don't go all the way down. Use a higher chair or even a countertop. The key is to challenge yourself safely. Now, if you feel sharp pain, not just muscle fatigue, or if you feel dizzy or experience chest pain, stop immediately and consult your doctor. The second daily essential is balance training. Falls are the leading cause of injury-related death in adults over 65, and most falls happen because of poor balance, not because of slipping or tripping. Your balance system relies on input from your eyes, your inner ear, and sensors in your muscles and joints. All of these decline with age, but you can train them. The simplest balance exercise is single leg standing. Stand next to a countertop or sturdy piece of furniture. Lift one foot a few inches off the ground and hold that position for as long as you can, up to 30 seconds. Keep your standing knee slightly bent, not locked. Do this on both legs twice a day. If this is too easy, try it with your eyes closed, but only if you have something to grab onto. If it's too hard, just shift your weight onto one leg, while keeping the toes of your other foot lightly touching the ground. Over time, your balance will improve dramatically. You'll notice that you feel more stable when walking on uneven surfaces, getting in and out of the car, or reaching for things. Balance training also activates the small stabilizing muscles in your ankles and hips that don't get worked during regular walking. The third thing is upper body and core strengthening. You need upper body strength to carry groceries, lift grandchildren, open jars, and push yourself up if you fall. You need core strength to protect your spine, maintain good posture, and transfer force between your upper and lower body. One of the best exercises you can do at home is the wall push-up. Stand facing a wall about 2 feet away. Place your hands flat on the wall at shoulder height and shoulder width apart. Keep your body straight from head to heels, engage your core, and bend your elbows to bring your chest toward the wall. Push back to the starting position. That's 1 repetition. Start with 8 to 12 repetitions, once or twice a day. If this is too easy, step further from the wall or progress to doing push-ups on a countertop. If you have wrist pain or shoulder issues, adjust the hand position or reduce the range of motion. For your core, try this simple exercise. Sit or stand tall, pull your belly button toward your spine, and hold that contraction for 5 to 10 seconds while breathing normally. Release and repeat 10 times. This engages your deep core muscles, which stabilize your spine and pelvis. These muscles are often weak in older adults, contributing to back pain and poor posture. The fourth essential is daily stretching and mobility work. Stiffness is not a normal part of aging. It's a result of inactivity and loss of range of motion in your joints. When your joints don't move through their full range regularly, the connective tissues shorten and stiffen. This makes movement harder and increases injury risk. Every morning or evening, spend 5 to 10 minutes doing gentle stretches. Focus on the areas that tend to get tight: your hip flexors, hamstrings, calves, chest, and shoulders. For your hip flexors, try this. Stand in a split stance with 1 foot forward and 1 back, like you're taking a long step. Gently push your hips forward while keeping your back straight. You'll feel a stretch in the front of your back hip. Hold for 20 to 30 seconds, then switch sides. For your hamstrings, sit on the edge of a chair, extend one leg out in front with your heel on the ground, and lean forward from your hips until you feel a gentle stretch in the back of your thigh. For your calves, stand facing a wall with your hands on the wall for support. Step 1 foot back, keep that heel on the ground, and bend your front knee until you feel a stretch in your back calf. Stretching should feel like a gentle pull, never painful. If you feel sharp pain, or if the pain worsens over the next day or two, you've stretched too aggressively. Back off and progress more slowly. The fifth and possibly most important thing is simply moving more throughout the day. This isn't about formal exercise, it's about breaking up long periods of sitting. Research shows that sitting for more than 30 minutes at a time accelerates muscle loss, stiffens your joints, and increases your risk of cardiovascular disease, diabetes, and even cognitive decline. Every 30 to 60 minutes, stand up, walk around for 2 to 3 minutes, do a few of those sit-to-stand repetitions, or just march in place. If you watch television, stand up during commercials. If you read, set a timer to remind yourself to move. This frequent movement keeps your muscles engaged, your joints lubricated, and your metabolism active. It also helps regulate blood sugar, which is especially important if you have diabetes or prediabetes. Now let's talk about how to put this all together into a daily routine that actually fits into your life. You don't need to do everything at once. In fact, spreading these activities throughout the day is often more effective and more sustainable. Here's what a sample day might look like. When you wake up, spend 5 minutes doing your stretches while your coffee brews. Mid-morning, do 2 sets of sit-to-stand exercises, about 10 repetitions each. At lunch, practice your single leg balance while waiting for your food to heat up. Afternoon, do a set of wall push-ups and core holds. Evening, take a 10 to 15 minute walk, and every time you get up from the couch, challenge yourself to stand without using your hands. Before bed, do 1 more round of stretching. Total time commitment is less than 20 minutes of focused exercise, plus the movement breaks you're already taking. This is manageable, sustainable, and incredibly effective. Let me give you a few practical tips to make this easier. First, link your exercises to existing habits. Do your sit-to-stands every time you use the bathroom. Practice balance while brushing your teeth. Do wall push-ups while waiting for the microwave. This technique, called habit stacking, makes it much more likely that you'll stick with the routine. Second, track your progress. Keep a simple notebook or use your phone to record how many repetitions you did or how long you held your balance. Seeing improvement is incredibly motivating. Third, adjust for your current level. If you're starting from a place of low fitness, or if you have multiple health conditions, start with fewer repetitions and shorter durations. You can always build up. It's better to do a little bit consistently than to do too much once and then quit because you're too sore or injured. Fourth, listen to your body, but understand the difference between discomfort and pain. Muscle fatigue and a mild burning sensation during exercise are normal and expected. Sharp pain, joint pain that persists after exercise, dizziness, chest pain, or shortness of breath that's out of proportion to the effort are not normal. Stop and seek medical attention if you experience any of these. Let's talk about common concerns and modifications. If you have arthritis, these exercises can actually help reduce pain and stiffness by strengthening the muscles around your joints and keeping them mobile. But you may need to modify. Use a higher chair for sit-to-stands, reduce the range of motion in your stretches, and avoid exercising during a flare-up when your joints are hot and swollen. If you have high blood pressure, avoid holding your breath during exercises, as this can spike your blood pressure. Breathe continuously and smoothly. If you're on blood pressure medication, be aware that you might feel lightheaded when standing up quickly. Move slowly and keep something nearby to hold on to. If you have diabetes, these exercises will help control your blood sugar. Check your blood sugar before and after exercise initially to see how your body responds, especially if you're on insulin or medications that lower blood sugar. If you have osteoporosis, strengthening exercises are crucial because they help build bone density. However, avoid forward bending and twisting movements that put excessive stress on your spine. Stick with the exercises I've outlined, and consider adding gentle backward bending to strengthen the muscles along your spine. Now I want to give you a quick checklist you can use to assess whether you're on the right track or whether you might need additional help. This is not a diagnostic tool. It's simply a way to monitor your progress and identify when you should talk to your doctor or a physical therapist. Ask yourself these questions once a month. Can I stand up from a chair without using my hands? Can I balance on one leg for at least 10 seconds? Can I walk for at least 10 minutes without significant fatigue or pain? Can I reach overhead and behind my back without severe limitation? Am I moving around at least every hour during the day? If you answered yes to all of these, you're doing great. Keep up with your routine. If you answered no to one or two, those are areas to focus on. Double down on the exercises that target those specific functions. If you answered no to 3 or more, or if you're not seeing any improvement after 4 to 6 weeks of consistent effort, it's time to consult with a healthcare provider. You may benefit from a formal physical therapy evaluation or a checkup to rule out underlying conditions that could be limiting your progress. There are also some red flags that should prompt immediate medical attention. If you experience sudden severe weakness in an arm or leg, especially if it's on one side of your body, that could be a stroke. Call emergency services immediately. If you have chest pain, pressure, or tightness, especially with exertion, that could be a heart problem. Don't wait. Get evaluated. If you fall and hit your head, especially if you're on blood thinners, you need to be seen even if you feel fine. If you have sudden onset of severe back pain with numbness or tingling in your legs or loss of bowel or bladder control, that's a spinal emergency. If you have calf pain, swelling, or redness in one leg, that could be a blood clot. These are serious conditions that require immediate care, and no home exercise program can address them. I also want to talk briefly about nutrition because you can't out-exercise a poor diet, especially after 55. Your muscles need protein to repair and grow stronger. Aim for at least 20 to 30 grams of high-quality protein at each meal. That's about the size of your palm of chicken, fish, lean beef, eggs, or a cup of Greek yogurt or cottage cheese. If you're not eating enough protein, your body will break down your muscles to get the amino acids it needs, which accelerates sarcopenia. You also need adequate vitamin D and calcium for bone health. Most older adults are deficient in vitamin D, which affects muscle strength and balance. Talk to your doctor about checking your vitamin D level and supplementing if needed. Stay hydrated. Dehydration reduces muscle function, increases fall risk, and makes you feel fatigued. Aim for at least 6 to 8 glasses of water a day, more if you're exercising or it's hot outside. And don't skip meals. Erratic eating patterns disrupt your metabolism and make it harder to maintain muscle mass. Let me also address a question I get constantly. What about pain? Should you exercise through pain? The answer is nuanced. Mild muscle soreness the day after exercise is normal, especially when you're starting a new routine or increasing intensity. This is called delayed onset muscle soreness, and it typically peaks about 48 hours after exercise and resolves within a few days. You can continue exercising with mild soreness, just perhaps at a lower intensity. However, sharp pain during exercise, joint pain that persists or worsens, or pain that interferes with your daily activities is not normal. That's a signal to stop and reassess. You may be doing too much too soon, using poor form, or there may be an underlying issue that needs medical evaluation. Pain is your body's alarm system. Don't ignore it, but also don't let the fear of pain prevent you from moving. The goal is to find the sweet spot where you're challenging yourself enough to make progress, but not so much that you're causing harm. One more myth I want to bust. Many people think they're too old to start or that they've missed their window. This is absolutely false. Studies show that even people in their 80s and 90s can gain significant strength and mobility with proper training. Yes, it may take a bit longer to see results compared to someone in their 50s, and yes, you need to be more cautious about progression. But the fundamental principles remain the same. Your muscles, bones, and nervous system retain the ability to adapt throughout your entire life. I've had patients in their mid-80s who went from needing a walker to walking independently after just a few months of consistent strength and balance training. It's never too late to start, but the best time to start is always today. So here's your action plan. Today, right now, do one set of sit-to-stand exercises, just 5 repetitions. That's your starting point. Tomorrow, add in the single leg balance practice. The next day, add the wall push-ups. By the end of this week, you'll have all 5 components in place, and you'll have started building a habit that can transform your quality of life. Remember, the goal is not perfection, the goal is consistency. Some days you'll feel strong and energized, and you'll do more. Other days you'll feel tired or stiff, and you'll do less. That's completely normal. What matters is that you show up for yourself every single day and do something, even if it's just 5 minutes of movement. Before we wrap up, let me summarize this in 3 key points. First, muscle loss and declining mobility are not inevitable parts of aging. They're largely the result of inactivity, and you have the power to change that. Second, the most effective strategy is a combination of strength training, balance work, mobility exercises, and frequent movement throughout the day. You don't need fancy equipment or hours of time. You just need consistency and the right exercises. Third, start where you are, progress at your own pace, and pay attention to your body. Challenge yourself, but do it safely. And always consult with your healthcare provider if you have specific health concerns or if you're not seeing improvement. If you found this information valuable, please subscribe to this channel and hit the notification bell so you don't miss future videos, where I'll dive deeper into topics like nutrition for healthy aging, managing chronic conditions, and preventing the most common health problems in older adults. Share this video with someone you care about who could benefit from staying mobile and strong. Leave a comment below and let me know which of these exercises you're going to start with, or tell me what specific topics you'd like me to cover next. I read every comment and I use your feedback to create content that truly helps you. And finally, a very important disclaimer. This is educational information based on current medical evidence and clinical experience. It is not a substitute for personalized medical care. Every person is different, with unique health histories, conditions, and risk factors. Before starting any new exercise program, especially if you have chronic health conditions, take multiple medications, or have had recent surgery or injury, you should consult with your physician or a qualified healthcare provider. They can assess your individual situation and provide guidance tailored specifically to you. What I've shared today are general principles that apply to most people over 55, but your doctor knows your specific circumstances and can help you implement these strategies safely and effectively. Thank you for watching. Now go take that first step. Stand up from your chair without using your hands. See how it feels. That's your baseline. In just a few weeks of following this routine, you're going to feel stronger, steadier, and more confident in your body. You're going to move better, feel better, and live better. I'll see you in the next video.